As you can see, we are in a new building which is called the Northern Centre for Cancer Care in North Cumbria. This building has started treating patients a couple of weeks ago. It's a state-of-the-art building to provide non-surgical oncology treatment to cancer patients in North Cumbria. And that includes the full suite of radiotherapy and systemic anti-cancer therapies. So we know cancer treatment is not just about drugs and radiotherapy, it's about the holistic needs of the patients. And I think having a lovely environment like this one would definitely help the psyche of the patient, would make them feel happier, and that's part of the treatment success. It's not all about, giving the chemotherapy and off you go home. It's about how you feel in general. And I think having a nice environment goes a long way to help that.
Now we're working very much in parallel with the way that Newcastle work, and for the patients here that means that they've now got the advantage not only of getting the great care that they've always got in Carlisle and into Cumbria, but also having access to that new technology, and that's the same across the chemotherapy. They've got a great environment. That's what we're bringing. It means that patients don't have to travel to the Freeman, they can get their treatment locally.
I think it's going to be absolutely amazing. I think the people of Cumbria deserve this. This is absolutely amazing and the patients are just going to love it. All the services are together, we're all here together. It's just going to be incredible.
It will give the patients that feeling that, of a special centre for them, and that there are resources here for them. It's beautifully designed and very pleasing. It's airy, light, and gives a feeling of hope and also of nurture, and I think that's really important for patients. This new centre will give them that feeling that things are being done, things are being brought together, for them.
This building meant a lot to me. I'm very happy this building is built here in Carlisle, because I have my first cycle of chemotherapy in Freeman Hospital and it was a bit hard to travel, so I'm happy it is here in Carlisle and I continue my treatment here. So I'm very, very happy. It's amazing, it's very nice with the pictures and it's colourful.
It's a very calming space, and when you go into individual rooms to be with a nurse or with a doctor, they're lovely big rooms, there's lots of air. Especially now with COVID, I feel like the space it's a very healthy space, because there can't be too many people because there's a lot of fresh air, but it's just very calming. And if I have to sit in the waiting room for half an hour waiting for my husband to collect me, I can read my book and it's quiet, it's lovely.
When we walked into the reception area, a beautiful reception area, there's a little cafe in there where you can have a coffee, there's seating for everybody, very nice.
We want it to feel more like a homely environment. It's the fact that it's not too clinical, and we really strive to sort of take that clinical edge away from it. So when you come in, everybody's been blown away by the colours, the seating. It doesn't look like you're coming into some sort of institution. It looks like, the aim of the game, everybody's been blown away by the reception desk upstairs. It looks like you're coming into some sort of hotel.
This means to the patients better journey in a calm and state-of-the-art environment under one roof. We have installed a new radiotherapy machines with new software that will allow us to treat patients accurately and safely and with minimal side effects. In addition to this, the chemotherapy unit capacity will be increased by 50%. This will mean that patients will have to wait even less time to start their chemotherapy. At the moment, the waiting time is about 3 to 4 weeks, which is well within the national targets, but with the increased capacity, that wait will be even shorter.